let's move into what goes on the brush, toothpaste. And I know you're a big fan of this, and more recently I've become a fan as well, hydroxyapatite. So, as we enter this part of the conversation, let's talk about what that is and then the different types.
So hydroxyapatite is, to make it very simple, is the material, the framework, the reason your teeth are hard and firm and are able to chew food and break down food and begin digestion, allow you to smile. That is the major ingredient in your teeth, hydroxyapatite. It is biomimetic. In other words, it exists in nature. It's in your saliva, or it should be. It's a form of calcium. It's a calcium hydroxyl group. It's got a hydrogen atom in it, some phosphorus. It probably varies a little bit from person to person based on diet, how many electrolytes you have in your system, how well hydrated you are, and the foods you eat, and also pH and dryness of the mouth. But the point is that it's natural, and that's the micro version of it. There's a big controversy between micro and nano. I'm going to get into that. Don't worry. Everybody wants to hear about that. But so that's the micro version. It's natural. They grind it up and they can put it into toothpaste, and that's fine. It does, if it's well made, it dissolves into your saliva, and it's there waiting for when your teeth start demineralizing. Remember I talked about critical pH, and it's not, so the pH of the mouth based on saliva in a healthy mouth is 6.8 to 7.2. It's typically just below 7. 6.2 is when dentin starts the process of dissolution. In other words, it starts dissolving. Dentin is the root structure of your tooth, and enamel starts at 5.5. Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, not to pick on them, but they're pretty low, but there are several others. Coffee, wine, iced tea, my favorite. Those start off at a low pH. And if you're drinking a lot of that, you are forcing that critical pH to drop, and your teeth are dissolving. Calcium is being lost. That's why you want it in saliva, because when the critical pH recovers and goes above the 6.2, the 5.5, then what's the opposite of dissolution? Oh, precipitation occurs. In other words, calcium gets put back into the tooth, hydroxyapatite. That's why it's important to be well hydrated. That's why it's important to have a lot of minerals in your system. Saliva is created by your saliva glands. There's capillary blood flow and capillary beds around your saliva glands. Saliva is very similar to blood, minus the red blood cells and some other ingredients. So it's a very important bodily fluid. Without it, you would be dead. You wouldn't be able to digest your food. Your oral microbiome would be a mess. You would get infections. It's like having a bed sore. You would have rampant gum disease, and you would die from that. Sepsis or slower Alzheimer's, high blood pressure, heart disease, cardiovascular events, that kind of thing. So hydroxyapatite is normal. Now, there is so let me start off by saying micro is ground up calcium, but it's not very bioavailable. In other words, you can dissolve it into saliva, but it's a big chunk of calcium, even though it's dissolved. And when it comes time to be brought to the tooth surface to be remineralized, the chunks, the molecular form of that calcium is so large that it won't fit into all these small demineralized areas, and it won't remineralize those areas. That's where nano comes into play. So nano is under, 100 nanometers. It comes in different sizes and shapes below 100 nanometers. Micro would be above that. And by the way, that's a line drawn in the sand by scientists. In fact, the Europeans are thinking of changing that designation of what is considered to be nano and what is considered to be micro. So again, it's just a line in the sand. But to make micro into nanoparticles, which they're 25x smaller, something like that, you have to synthesize it. You have to manufacture it. So you grind it up even into smaller pieces. But you can make, the end result can be needle shaped, it can be rod shaped, it can be more cylindrical shaped. They're different shapes and they're different sizes. And then there's the quality of the calcium. These hydroxyapatite companies are all over. They're in Asia, they're in Europe, they're here in the US. Fewer than you would think. I think there's one in Canada. The best one is in Portugal. If you want to get into the weeds, we can talk about that. They make the best nano and the safest version of nano hydroxyapatite. But nano has it's a 4-letter word, right, in health care. And nano means it's something that is so small that it can get embedded in the body and it's there for life. Well, that's nano titanium. That could be nano silver. Those are metals and other products that don't dissolve. Nano hydroxyapatite, let's just call it calcium. Nano calcium, the minute it hits cellular fluid or a biofilm or saliva, it dissolves and it's in suspension. The good news is that it dissolves into smaller pieces, and when it's presented to that demineralized, that cavity-forming surface of the tooth, whether it's on the root surface or on the enamel, it gets taken up that much more readily, probably even more readily than fluoride. And it's not as electronegative as fluoride, but it has a smaller particle size, so it's more likely to get groups of these little nanoparticles. And by the way, they should be rod-shaped. There are very specific specs on what is the best nano for safety and for efficacy. According to the Europeans, there's no American body that is making these decisions, or Canadian, North American body, which is typical. But so these small particles are way more effective. In fact, I would argue that having micro in your toothpaste is a complete waste of time. And there's calcium. We've had natural toothpaste with calcium carbonate in it. It's a different form of hydroxyapatite. And again, these ions bond to, they're attracted to each other via negative and positive charges, opposite charges. Cationic bonding, and that's what saliva is. It's a cationic solution. It's a supersaturated solution of minerals. And when it sees a positive charge, then these particles are attracted to each other. And pH has a lot to do with that. And that's why when the pH goes above critical pH, that electrical charge, that equilibrium of dissolution to precipitation changes and it doesn't occur. So if you're below that critical pH, you're losing calcium in the tooth. If you're above it, you're laying down calcium. The teeth are taking up that calcium and rebuilding themselves. This is a natural thing. The body has always been doing this. Our ancestors had this mechanism. They were eating raw fruits and, raw vegetables, maybe fruit on occasion, some dates. That would happen occasionally. They would eat raw meats, and then they would cook their meats, and a lot of dairy products, fermented dairy products, and even compared to our current meats selection and fermented products, much, much different. Even the vegetables were different. They really were, that mechanism worked fine. They never got cavities. There may have been some critical pH moments, acid attacks in the mouth, and then it was quickly reversed and healed. And also, they didn't eat as often as we did. We snack constantly. And that is so hard on this remineralization, demineralization equilibrium, because it's always trying to fix the teeth. It never has the time to rest. That's why taping up your mouth at night is so important. That's a 7-hour rest where the body has a chance to remineralize your teeth. Clean them, brush them, floss them, thin that, reset the biofilm, tape up your mouth to keep the saliva in there, add the hydroxyapatite. Oh, by the way, important for oral care regimen, don't spit out. You can spit out, but don't rinse after using a hydroxyapatite toothpaste. So I just coat my teeth. I use a nano manual toothbrush. It's like a squeegee. I get that toothpaste on there, and then I put my oral appliance on. I'll spit out, but I put the oral appliance on there, so my teeth are coated in hydroxyapatite all night long. That 7-hour window is wonderful for repairing your teeth. If you're snacking all day long, that window doesn't exist. You're always on this side, on the demineralization side of the equilibrium. If you're sipping on a Diet Coke even, a sugarless beverage, or even an iced tea, any snack, any cracker, for example, a saltine cracker, or even a healthy rice puff or something, without industrial seed oils. And it doesn't matter. The bacteria are very active in the mouth and they are demineralizing your teeth. So that's another reason intermittent fasting works well in the mouth. So if you're going to snack on a raw carrot, don't worry about it. If you're going to chew on some xylitol gum, don't worry about it. But typically our snacks, even any healthy sports bar, probably is causing an acid attack in your mouth. And we snack on that at work. We drink coffee at work.
I want to highlight what you're getting at here. The fact that it's not necessarily the amount total, it's the number of touch points.
It's
And because of the modern way we snack and we drink, we have touch points all through the day affecting that acidity, causing the issue.
Exactly. So the frequency is more important than quantity. So if you're going to have that birthday cake, wolf it down quickly and don't do it again for a few days. Let the teeth recover.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Most acidic drinks like kombucha and a lot of mineral waters, Perrier, for example, they're pretty low. Coffee, wine, iced tea, my favorite, those start off at a low pH. And if you're drinking a lot of that,